Over the last few years, there's a lot of trust and faith that's been eroded away from the healthcare system. Patients don't know what to believe. There's a lot of misinformation. Medical information is confusing. When you're sick, it's even more confusing. Cardiology is a fascinating field, ever-changing, rapidly evolving. Sometimes patients feel they're not being offered the latest cutting-edge technology that might be available. I know you're scared. You're going through it. You don't know what's going on. I'm here to help you understand what's going on.
Most people don't struggle with heart disease because they lack information. They struggle because they don't understand their options. Oftentimes, people are told they need a medication, a procedure, or a device, but no one really fully explains why, when, or what happens if they wait. So that's what the show is here to change. Welcome to Cardiovascular Therapeutics Unplugged. Real conversations about heart treatments that change lives. Dr. Mehra, interventional cardiologist, is here to share more about why the show exists, what patients are missing in today's healthcare system, and how understanding treatment decisions can change outcomes. Dr. Mehra, I'm so glad to be here with you. I'm so happy to dive into this first episode of Cardiovascular Therapeutics Unplugged. Let's dive into it. Let's start to the core. Are you excited? How are you feeling about your first episode?
I'm feeling great, Leila. This is my first foray into doing a podcast. I'm looking forward to it. Like you said, I'm an interventional cardiologist. I've been doing this for a while. I've been in practice for about 15 years, and I just have been thinking about starting a podcast or just in general speaking about the latest and greatest in cardiovascular technology and therapeutics. This is what excites me on a daily basis. So I'm looking forward to it. Just the one thing that I wanted to say is that, going forward, there's going to be a variety of episodes on all different topics, and the views expressed on this podcast are purely mine. They're not meant to be medical advice. It doesn't represent any institution. This is just something that I try to talk about and speak to the population in general about discussing various cardiovascular issues. But please speak to your own physicians if you do have any cardiovascular issues that you need to discuss.
Absolutely. Thanks for saying that. And I know we talked about this previously, but I admire that you're so passionate about it. I know, like you said, this keeps you going every day. This is so exciting to you. So I know our listeners are in for a lot of good information. So let's hop in because I'm curious about your practice specifically and your day to day. What is the most common moment where you really realize that a patient may not truly understand their options, even though they may have already seen other doctors?
So, we see this every single day in our practice. Patients come in, they have a variety of questions. They are very confused about the information that they've been given about their specific clinical situation. So, that's where this kind of an informational podcast comes in. I feel like there's been a void essentially where there's a lot of talking heads out there giving a lot of information which may or may not be relevant specifically to this field. Patients don't know what to believe. There's a lot of misinformation. There's a lot of, hyped up information. There's a lot of healthcare gurus out there. So what my podcast is going to discuss is going to be essentially based on three foundational pillars. It's going to contain education. It's going to be about innovation. It's going to be about motivating patients to be a part of their own care. So, I see this every single day. Like I said, patients come in, somebody's talked to them, but they're really confused about where to go next. So over the course of these podcast episodes, we're going to discuss the various topics in cardiovascular pathology and therapeutics, such as electrical issues, interventional issues, heart failure issues, hypertension related issues. So, in each podcast, we'll discuss that.
Absolutely. And I know you've been practicing for so long, specifically practicing cardiology for such a long time and across complex cases and leadership roles as well. So, with your experience, was there maybe a specific moment or case or maybe even a pattern that you've seen over the years that really made you realize that patients weren't being given the full picture when it came to treatment decisions? And maybe that's why there's, like you just said, some confusion about where to go next.
Yeah. So, this occurs every single day that we face situations where, there are complex cases with complex possible treatment options that have not been fully discussed with patients. So, like I said earlier, I grew up in Jersey. I trained in Philadelphia. I went to college at University of Pennsylvania. I trained at Medical College of Pennsylvania for med school and residency, and then came back to Robert Wood Johnson right here in New Brunswick for general cardiology. And then I went to Providence, Rhode Island Hospital for my interventional year. Interventional cardiology is essentially an extra year of super fellowship that you do to become an expert in angioplasty and stenting and, minimally invasive cardiac interventional procedures. So over the course of, I finished in 2010, and in the last 15 years, I've seen multiple clinical scenarios where patients are confused. I practice in Ocean County and Monmouth County. We have a large elderly population, which has a huge cohort of patients who have cardiovascular issues, from hypertension to coronary artery disease to arrhythmias. And there's just a significant burden of disease. So we face these situations on a regular basis. So let me give you an example. Recently, I saw a patient, a 70-something-year-old female with diabetes and hypertension, who came in, was having palpitations. I saw her for the first time as a consultation after being referred to me by her primary care physician. And, she was diagnosed with atrial fibrillation. She didn't know what that meant when she got to me. She didn't know. She was scared. She didn't understand what the ramifications of having that arrhythmia were. And she wasn't sure if we were, adept to handle the situation locally. Should she go to Philadelphia? Should she travel to New York, which is not an easy thing for, the elderly patients in the area? That's the kind of stuff that I think is lacking in disseminating information to patients where they feel unsure about their care. So I sat down with her. I discussed exactly what the issues are, what we can do to treat it, who are the doctors that specialize in treating it, what are the risks of the specific arrhythmia, and kind of put her fears to rest. She left the office. She was very happy with the care. And, that's the kind of stuff that I want to address in this podcast, where I'm able to speak to patients and give them information that might be lacking.
Absolutely. I think it's so important because even I could only imagine it being harder for an elderly person, but I'm just thinking as myself, if I was a patient, I wouldn't particularly know what those things are or how that would affect me. And it's super nerve wracking, especially for someone elderly. So it's so important to be able to break that down to a patient and explain not only their options, but really go a step deeper in explaining what exactly is going on. For those who are not educated in a medical space or a medical background, we don't always know what these things are, and it's happening within your body. So it's so important to be able to really take the time to explain that and break that down. I know that you work at the intersection of advanced procedures, heart failure, and also really big critical decision making. So how has being in those high stakes environment really shaped the way that you think about explaining your options to patients?
Like I said, the three pillars of what a good doctor-patient relationship is education, innovation, and motivation. So education essentially means you yourself have to be educated. You have to know what's going on in the world, the cutting edge technology, what are the medications out there, and you have to keep up with the guidelines. Cardiology is a fascinating field, ever changing, rapidly evolving. And if you get left behind, you're going to be practicing medicine from a decade ago. So, in addition to staying board certified, taking your exams, I go to multiple conferences. I am involved in clinical research at the hospitals that I'm working out of. At the same time, education also involves educating the patient, constantly educating the patient, letting them know, breaking it down without any medical jargon. What is it that they have? Where do we need to go? Keeping it very, very simplistic, explaining things like you would be talking. I've got a 12-year-old and a 9-year-old, how you break it down and you say, listen, this is what it is, so that they can understand what's going on. That part is the most important part, I think, in developing that patient trust, doctor patient trust relationship. The second part is innovation, understanding that there's constant innovation and research happening in our field. I've been involved in clinical research throughout my fellowship and then even in clinical practice. Even though I'm a private practice owner, practitioner, I have academic positions in the hospitals that I work out of. And, that keeps me involved in cutting edge technology. We publish papers, we teach residents and fellows. Staying on top of innovation is a key to staying ahead and being an educated physician. And then obviously the third thing is, like I said, motivation, motivating the patient to do the right thing, combining this, using the trust that you develop and having a shared kind of decision making process with them. So that's where my way of treating patients comes in.
Absolutely. And like you said, you have kids and 9-year-olds and 12-year-olds that you kind of break it down to. So being able to explain things in layman's terms for patients, I think, is so important. And like you said, innovation and being up to date on cutting edge technology and things of that nature. But being able to have that strong client, doctor patient rather relationship is so important because I know, for example, when patients hear the words procedure or device or intervention, it's scary. So when that happens and patients do hear those words, what do you think that they're actually afraid of? And how often is it that fear is based on misunderstanding more so than the actual evidence or science of what needs to happen?
Over the last few years, there's a lot of trust and faith that's been eroded away from the healthcare system. We in the West have led the way in modern medicine and advancements in healthcare for a long, long time. But over the last few years, there's been a constant, slow erosion that has kind of also come between the doctor patient relationship. And that, I think, leads to fear. That leads to misunderstanding. So I think it's, like I said, it's really important that you talk to your patients and break it down to the very basic stuff so that they understand that you have their best interest at heart. Patients have so much information that's coming at them from all different sources. I mean, we know that online and social media, there's so many things that are coming in and they don't know what to believe. And I think it's really imperative that we take control of our field once again as physicians, as board certified doctors that put in the years of training to educate our patients and allay their fears. I think that is key to reestablishing faith in the care that we provide. Sometimes I give this analogy that there's a lot of people who fly planes. I mean, you could fly a Cessna, you could fly a single engine plane, but you have to have special training and a certain number of hours and certain simulation. I've got a friend who's a pilot, so certain amount of simulation to fly a 777 Boeing. You can't just put in the bare minimum 40 hours and then start talking like an expert on flying a plane or flying a Boeing 777. Same thing, I think, in the field of medicine. We put in years and years of undergrad and med school and residency and fellowship, and then continue to practice medicine and hone our skills because every day is a learning experience. So I think when you work with that mindset that you're learning every day and you want to be better for yourself and for your patients, I think patients can see that. Patients can feel that in your conversations. That is what is going to lead to a better care paradigm for your patients. I think that's where trust comes in.
Absolutely. And I know you emphasize therapeutics beyond just cardiology, right? So, in simple terms or in layman's terms, what's the difference and why does that distinction matter so much for patients?
Therapeutics, it's got a wide gamut of things that it encompasses. Obviously, there's preventive care, which is the best kind of therapeutics, which everybody stresses on these days, and we're glad that people do. There's taking care of your heart, doing the right things, exercising, eating right, knowing your cholesterol, all that stuff, knowing your family history and risk factors. That leads to good preventive care. Then there's the pharmaceutical side of things. Knowing when to use, what to use, how much to use is key to having a good medical regimen for a patient. But at the same time, sometimes patients feel they're not being offered the latest cutting edge technology that might be available. So, for instance, a lot of people have heard about transcatheter therapies and transcatheter valvular therapies. Over the last 10 years, we've operated on so many people that needed their aortic valve, for instance, fixed. That used to be an open heart procedure till about 10 years ago. Now we're doing over 300,000 cases in the United States on a yearly basis. Till you tell people about it, most people don't know that this is available, and they think they have to go either to an academic institution in New York or Philadelphia or, somewhere else to get this. But we've been doing it, for example, at our local hospitals for the last 10 years. We've been involved in the pivotal trials to do these procedures. So that's the part that excites me. That's where therapeutics comes in.
Absolutely. And patients often think heart treatment decisions are straightforward, right? Test results equal treatment. But can you walk us through what actually goes into deciding when to intervene and when to wait and when maybe not to even treat at all?
This treatment decision, again, has multiple layers to it, right? The
Mhm.
first step is diagnosing the patient, listening to the patient's story. What is it that is going on in the patient's body, doing a thorough clinical evaluation, and using the right diagnostic modalities to come up with the right diagnosis. What are the things that are available to us to be able to do that? Over the last, let's say 20 years ago, we had a couple of diagnostic modalities in cardiology, like the echocardiogram, for instance, or an EKG or a stress test. But nowadays, most people have heard of calcium scores and coronary CTAs and cardiac MRIs and cardiac PET scanners. So there's so many more imaging modalities that are available to diagnose somebody accurately. So listening to the patient, diagnosing them correctly, using the right diagnostic modalities is key to making that decision process, because if you don't diagnose them correctly, you're not going to treat them correctly. Second step is to talk to the patient so that they understand what their disease process is. It should be clear to them what they're dealing with so that the fear factor, again, is mitigated. Third step is understanding their symptoms and what the ramifications of their disease process is. The fourth thing is talking to them about where do we go from here? What are the treatment options that are available to them? And that's where the shared decision making process comes in. So, I think there are multiple layers to the treatment decision process, but again, it's about having the knowledge to take care of the patient at every step, whether it's the diagnosis, whether it's the treatment, whether it's the education, whether it's the prognostic kind of phase of the patient's disease.
Absolutely. And you mentioned all of these, sounds like to me, cutting edge ways to diagnose and all these different scans that I see how important and how really knowledgeable you are on all of these different tools. As someone that's not in the medical field and is, learning this for the first time right now along with you, it is so interesting and how that there are so many ways to really diagnose and all these different technologies. And I think that you touched on this earlier. There's all this information online and all this content. And I think that there's more and more every day. There's no shortage of heart related content online, podcasts, reels, articles. But what do you think is missing from most of it? And how will your show be different from what patients are used to hearing?
So again, like we said, medical information is confusing. When you're sick, it's even more confusing. If this is not what you do for a living, it's scary. And then getting the information every day, I get patients. Doc, I know it's wrong, but I Googled it. And I never say anything to them not to Google, or I tell them, listen, it's available. The point is that you're doing your best to educate yourself with whatever you have available. But I'm here, okay? I'm here to help you understand what's going on. And it's okay to try and figure it out. I know you're scared. You're going through it. You don't know what's going on. But this show is another avenue of educating patients, letting them know what we have in the area, what hospitals, what are we doing at our local hospitals? Okay. What therapeutics are available in the world these days? If I need to send somebody to a transplant center, I can educate them about that. Every hospital in the state is not doing transplants. In case, unfortunately, if they're at that stage where they need a very advanced therapies, we have access to them. We know what to do, where to go. I'm not trying to educate the world about it. I'm just trying to educate my little ecosystem here. And even if I can educate my patient population in Monmouth, Ocean County, and maybe New Jersey as a whole, I think I've made a difference in the lives of people as far as them knowing where to look. So that's what this show is going to do. At the same time, the other aspect is this excites me. The cutting edge stuff personally excites me. I want to be able to talk to the local experts about this stuff. I want to be able to talk to my colleagues at different institutions who might be in different subspecialties of cardiology like heart failure and electrophysiology, interventional cardiology or structural heart. I have some of the greatest and most well-trained colleagues in the area. So I'd love to have those conversations with them so that we can educate everybody together and learn from each other together. Yeah, that's the purpose of this show. Just simple cardiovascular conversations and staying cutting edge.
I think those conversations are so important, and opening them up to, like you said, all your colleagues and other people. And if you can help the people in Jersey and, like you said, your ecosystem, it would be great. And having these conversations are so important, and it's just the start to several conversations to come. If someone's listening to this podcast right now and, maybe even for the next 6 months, what would you want them to be able to say they understand now that they didn't prior to listening to your show?
It's not for everyone. It's for people who are interested in cardiovascular issues. My core audience might be physicians who like to listen to this on their drive to work. The latest specific subspecialty of cardiology, such as heart failure or arrhythmias. We could be talking about some therapies that came out, which might be better for treatment of a certain pathology. And the other set of core audience is going to be patients who are going through this, who might not know where to look, and they turn it on, turn the radio on or Spotify on, and they listen to this and they have an idea of, what's going on locally, what's going on at the local hospitals. If they have questions, where can they turn to? There's so many hospitals and experts that are taking care of the most complicated issues. I think it's going to be an enlightening experience when we discuss specific disease processes. So, yeah, that's what I'm aiming for.
Absolutely. And I think this is exactly why the show matters, because cardiovascular care isn't just about tests or procedures. It's really about understanding choices, especially when the stakes are high. So this podcast exists to replace the confusion with clarity, replace fear with understanding, and passive patience with informed decision makers. So Dr. Mehra, thank you so much for setting the foundation today. There's so many more conversations to come. This is just the start. And to our listeners, if you've ever felt rushed into a heart-related decision, or if no one has really taken the time to explain your options clearly, the show is for you. This is Cardiovascular Therapeutics Unplugged, real conversations about heart treatments that do change lives. Thank you again, Dr. Mehra. I think I'm excited to continue the conversation, and this was a great first episode.
Thank you, Leila. Thank you so much for hosting this. I look forward to recording more episodes where we talk about specific topics. I hope that I can get some of our local experts to chime in and, shed some light on the latest and greatest in cardiology as we speak about it. So thank you so much.